Hello, everybody. My name is Martins Chinedu Marvin, and I am the chairman and founder of Rockians Medical Foundation. Thank you all so much for taking out the time to be here today. Permit me to assume that this presentation will also be seen by non-RMF members and non-RMF volunteers, right? First of all, I would like to personally thank each and every one of our volunteers for their unwavering support and their hard work and dedication throughout 2024. I mean, we achieved quite a lot in 2024, even though a lot didn't go as planned, but we know that goals were set and goals were definitely achieved. And none of this would have been possible without every single one of you. If you remember very well from last year, we discussed a lot and emphasized expanding our collaboration portfolio many times, right? Well, that plan has not changed at all, but we could say that that plan has improved in various ways. What this means is that we have added so many other achievables to our focus board for 2025. Now, all of these achievables put together will set us up for growth in the right direction and position us for global opportunities. So this year, we would have to focus a lot of our energy on strengthening Rockians Medical Foundation for long-term impact. What this means is that we would have to focus on improving our capacity in all aspects, from our organizational structure to increasing collaboration to evidence-based projects to building volunteers' capacity. The target here is that all of this put together will not only improve the efficiency of RMF and the efficiency of RMF projects, but also position us for bigger and better opportunities, just like I said before. Now, one of our major goals for this year is grant writing. For the longest time, we have been limited to fewer grants because of many of the grants required organizations with proof of work or organizations that have been active for at least 2 years. But because of all of the work that we've been putting in for almost 3 years now, or over 3 years, we can qualify for some of these grants. Though there's still a lot of work to do to increase our eligibility for grants, right? Which are part of our core goals this year. And we are going to be talking about them in this presentation as well. So the plan is to apply for at least 3 grants per month throughout the year, and so far we have taken some steps to showcase our commitment to achieving these goals. And one of those steps includes our paid premium membership for platforms like Grants for Me and platforms like Funds for NGO. These are platforms where they list various kinds of grants that are available, and then you can just search for the ones that you are eligible for, right? And we've also successfully completed a grant writing course with Grant Success School to improve our skill and also improve our chances. We have also completed 76% of our grant writing goal for January, because since the goal is to write 3 per month, we have successfully completed 2. We have also successfully completed 6.5% of our yearly goal for grant writing as well. So I guess we could say that we are starting off very, very strongly, and we hope that we continue in this pace. And please, guys, before I move to the next slide, please pardon the fact that I am taking this very slow and I sound very slow. I'm trying my possible best to ensure that every single one understands the concept of where we're going to this year. Okay. Now, our next goal for this year is volunteer development, which is extremely important for us to grow in the right direction. So RMF will be required to train interested volunteers on topics related to our objectives for this year, right? Now, this could be training on first aid, It could be training on malaria, it could be training on wash, it could be training on maternal health, depending on the direction we are going, right? We will also be sharing varieties of opportunities in our group, most especially scholarships, as well as conferences and workshops that are available, so that all of us can have the opportunity to develop ourselves in different aspects, right? But for that development to be possible, we all have to be actively involved in activities. So this year we are looking at delegating duties to interested volunteers and individuals. Now, there are some steps that we must have to take to showcase our commitment to what is required of us to develop or increase the capacity of our volunteers. And one of those steps includes RMF improving your understanding on our mission in Womio Village. What are the things that we have done so far, and what is left to be done? All of these questions will be answered so that you can have a full understanding of what is going on in Womio Village. We also plan to include our volunteers in competence-based first aid training that is prepared for some of these villagers, so you can also have the knowledge to act correctly in cases of emergency in your surroundings. This will also help us to reinforce our strategy to improve inflow of funds through first aid services for events, right? This is also one of our plans. We'll also be going out visiting different maternal health NGOs to hunt for best practices, and we're going to fully involve all of our volunteers who are interested, so that you can also improve your knowledge and prepare yourselves for our upcoming projects. We're going to talk about that as we proceed as well. If you remember from our previous slides, I spoke about evidence-based project as one of the components that will help us to build our capacity and position us for bigger opportunities, right? Now, PM Wash will be our first official evidence-based project. What this means is that we're going to have to integrate more data collection and more data or impact evaluation into PM Wash. But some of us here, I'm sure most of us here don't know what PM Wash is. So we're going to take a minute to talk about what PM Wash actually is. PM Wash simply means preventing malaria with health education and water, sanitation and hygiene intervention. Now, this project is specially tailored to reduce malaria infection and malaria-related deaths by 50% in any context that it is implemented into. Now, Womio happens to be one of the first official village that this will be implemented in, right? Even though we have not implemented it 100%, but we are heading to that direction. Now, this project is specially crafted to ensure an all-round protection against malaria, ensuring that there are no loopholes for reoccurrence of these diseases anymore, right? Now, we're going to be providing not just the knowledge, but also the tools and the infrastructure that will ensure that these villagers are able to protect themselves concretely and all round, right? So far, we are done with the infrastructure aspect of PM Wash by providing water and sanitation facility. But our work is not done because we have only completed 60% of PM Wash. So the remaining 40% will require us to carry out some of the things that are stated below the what next subheading. And one of these things include us conducting a 2 days fast track training program for some of the villagers, which will be focused on topics like competence-based first aid, early detection, rapid diagnostic testing and treatment, and would also follow this up with a 3 months mentorship to ensure that whatever it is that they have learned sinks and stays there, right? Also, we're also going to conduct a 3 months monthly community cleanup to ensure that we establish a routine of wash practices, so that even after RMF leaves, they will continue this monthly wash practices, right? We're also going to be distributing long-lasting insecticide mosquito nets to 118 households in Womio Village as well. We will also carry out a 2-phase general community awareness and practical demonstrations of how to treat, retreat, and maintain their mosquito nets, right? And one of the most important parts of this project will be monitoring and evaluation. Why? Because we want it to be evidence-based, so it's going to be a huge part of this project. And lastly, we're going to be carrying out a house-to-house or door-to-door training on vector control both inside and outside the houses for 100 selected households. Now, all of this put together is just a summary of what PM Wash is and what we are trying to achieve in Romeo Village. Ready Mama is another project that we're going to be pursuing this year because we're looking at expanding our scope to maternal health. If you have read our organizational charter, you'd see that maternal mortality is one of the rationales of RMF. What this means is that it's one of the reasons why we do what we do. One of my assistants in my pharmacy, her name is Virginia. Recently, she lost her baby just few minutes after delivery. According to her, she was told they didn't shake the baby properly. And to be sincere with you, I actually don't know what that means, but I'm hoping that we'll find out during the needs assessment, because the aim is to ensure that we eradicate preventable deaths like this. I don't know, some of you might know Dr. Chidera. Before she went for her master's in public health, she has actually been pushing for us to pursue a project in maternal mortality and child mortality as well. But this story, Virginia's story, it gave us that final push, and now we are here. Now, what is Ready Mama? I'm just going to read this out, okay? Now, Ready Mama simply means reproductive education and assistance for delivery, information and empowerment, supporting mothers through antenatal milestones and aid. This project aims to reduce maternal and child mortality through maternal health education, WHO approved kits, and 2G technology. Sounds interesting, right? Now, the WHO approved kits will include kits, delivery kits like cord clamp, mucus extractor, their pads, hand gloves. All these things are requirements for delivery, right? A lot of hospitals ask for these things. Now, for the 2G technology, we chose this specially because we noticed that a lot of the people who are trying to help are people from the rural areas, right? Are people from underserved community. A lot of them, they don't have access to Google like many of us do. They don't have access to Android phones like many of us do, right? But they have this small, the Nokia touch phone that we used to know, right? Now there is a way that we can actually integrate informations into USSD code, right? When you type maybe *556#, you get informations, lots of informations on maternal health, from nutrition to tests you're supposed to run, as in different kinds of information will be packed into that USSD code, right? This is the 2D technology we're talking about. We're also going to integrate SMS alerts that reminds these mothers to go for their antenatals, because you find out that a lot of people actually forget sometimes. Now, there is so much to unpack about Ready Mama, so much to talk about on this project, but because of time, this is already taking more than we planned for, right? So let's talk about the next thing. What next? What do we need to pilot Ready Mama? First of all, we'll have to conduct a survey, a needs assessment, right, to know if there's truly a need for this project. We're also going to be visiting primary healthcare centers to observe their antenatal visits, to know what it is that actually goes on during these antenatal visits. Do they conduct classes to teach these women what to do during every stage of their pregnancy, what to do after delivery, what to do? Do they teach them things on nutrition? Do they teach them things on febrile conversion? These are informations we want to know, right? So we know where we can come in. We have already prepared a 32 questions questionnaire, and the initial plan was to showcase it here, take us through every question, but because of time we're just going to skip that. So we're also going to be gathering maternal and child mortality stories. So please, if you know anybody at all that is willing to share their story, that have been a victim in the past, please refer them to us. We're also going to visit a lot of maternal health focused NGOs to learn best practices from them. We want to know what have they been doing so far, what have worked for them in the past, and what did not work, what are the mistakes they made, so that we're not going to go in blind. The next on our focus board this year is our structure. That is our organizational structure. And we have taken some steps towards strengthening our structure. We recently reached out to a doctor and also a radiographer who are both big advocates of public health, invited them to be part of our trustees, right? We will also reach out to other individuals who have vast knowledge in probably NGO management or public health, so that we can create an advisory board. Now, these steps will not only improve our credibility but also ensure the constant flow of valuable information to put us on the right path. Right now, finally, there are non-paid positions that needs filling in RMF. Right, as you can see on the screen, some of these positions were left vacant after some of our people traveled abroad for their masters. Some of them relocated, right, to other states here in Nigeria. But moving forward, we need some of these positions filled up. We need a project manager, we need monitoring and evaluation officer, we need midwives, we need social media managers. I'm not going to go into details of what these roles entails, right, because of time, but it is important to note that these positions are currently zero salary positions, right? You're not going to be receiving salaries for any of these positions for now, but any grant that gives us the opportunity to fashion in salaries into our budget, definitely you are going to get paid for any work that you do. And these positions is not for just anybody. It's for interested parties and also parties who already have credentials in this area or are willing to work and grow in these directions, right? So if you are interested, please reach out to me directly so that we can talk. The last goal on our 2025 focus board is collaboration improvements. So we are going to prioritize strengthening relationships as well as increasing the number of our collaborations, right? So please, if you know any organization that you would like us to collaborate with, feel free to refer them to us in the group chat, because these collaborations will definitely help to boost our visibility. It will also help to create networking opportunities for both you and I, for all of our members and our volunteers. It will also expose us to best practices. But for us to successfully collaborate with any of these organizations, there are 3 variables that we must consider. We must first of all ensure that their objectives aligns with ours or can be aligned with ours, right? And in such a way that it leads to contributing to SDG 3 or SDG 6 or even both together. Because just because we want more collaborations, this doesn't mean that we're just going to collaborate with every available project. Let's take, for instance, collaborating to advocate for voting in Nigeria, or something else that totally misaligns with RMF mission. I mean, we may care about the right to vote, but to vote personally, right? But this does not mean that it aligns with the mission of our organization. So we're not going to collaborate with projects like that. We will also focus on low budgets but high impact projects. This means that projects that are both pocket friendly but will still be very meaningful and very impactful to the beneficiaries. Now, with that said, I believe that we have come to the end of this presentation. Like I said before, all of these components put together will position us for bigger and better opportunities. We want to move this ship from cruise to control. And when I say control, I mean active, intentional control. We want to plus and minus to give us better clarity. So we would want to plus passion and plus capacity to give us results, and we want to minus excuses and minus irrelevant activities to give us action and focus. Thank you.